Hi everyone. Today I'll be discussing one of the very important stations in PLAB2 exam, which is called the ectopic pregnancy. Let's get started. In ectopic pregnancy, you can get two common tasks. One in which the consultant has already made the diagnosis and he has already decided to undergo for a laparoscopic surgery. And there is another one in which the patient only presents with pain and bleeding, and her LMP is given as 6 weeks, and you need to talk to her and address her concerns. So basically, you have to make the diagnosis and talk to the patient about it. So in either case, the main focus is the treatment of this condition and how you reassure the patient that her future pregnancy is safe and she has an increased chance of getting pregnant again or having a normal pregnancy. So she shouldn't be worried about it. These are the two major objectives. If the diagnosis has already been given and the consultant has decided to undergo for a surgery, then in the treatment section you will start with the surgical option, and you will describe laparoscopy in detail, the complications in detail, the entire procedure in detail. Okay, and in the other case where the consultant's decision has not been mentioned, then obviously you mention all the three options. So whenever starting this station, you obviously introduce yourself and make sure you know exactly how you're going to introduce yourself. So if you have not done it so far, please write a few lines on your notebook and memorize it. We all think we'll be able to introduce ourselves very easily over there, but it's an exam scenario and your first impression it means a lot. Okay, it matters a lot. So if you are confident, you have introduced yourself well, then the patient will also be confident in you and you will have a very good understanding with the patient as well. Then you confirm the patient details. How can you confirm the patient details? Even by just starting like Mrs. XYZ, I'm Dr. So-and-so. So just by taking the name, this is also one way of confirming the patient details, because the patient, she may nod or she may not say anything. Unless she said, no, this is not my name. If she's staying quiet and just nodding, that means she's confirming her detail. Or after introducing yourself, you can ask her, can I kindly confirm your name, please? And if the date of birth is given on the task, then you confirm that as well. Okay. Then the third step is always to ask the patient, does she know why she is here? Okay, in any scenario, whenever you're talking to the patient, you always have to find out if the patient is aware why she is here. Okay, you can ask her questions, direct questions like, do you have any idea why we are here today? Do you have any idea why we are chatting today, or what we are going to chat about? Has any of my team members spoken to you about your condition? Has anyone given you any information about your present condition? Or simply, what do you know about your present condition now? Can you please briefly tell me what do you know about your condition and what has happened so far? So she'll very briefly tell you that I came with pain and bleeding, and or she will say, no, I don't have any idea why we are having this conversation. Okay, they just gave me a ring and booked me an appointment and I'm here. So it is always important to know if the patient has an idea about the condition. Now, before jumping into the treatment and giving her all the information, we very briefly ask about how she's feeling now. It is very important to make sure that the patient is comfortable and she or he is not in pain or distress when attending any appointment, even in real life. That's how you deal with the patient. So by asking about the current symptoms, I'm not saying you need to go into a detailed history. So you can start off by saying, I believe you came here with pain and bleeding and your ultrasound was performed. Can you please tell me how you're doing now? Or you can say that, has there been any change in your symptoms? So basically you want to know about the progression of her symptoms. Has there been any increase in your symptoms, any increase in your pain or bleeding, or have they changed since your last checkup? So it's only one question, basically. That's what I mean to say, but it will give you those marks that yes, this doctor is concerned about the patient. Okay, then obviously the next step is to explain the diagnosis or disclose the diagnosis depending upon the task. Or the patient might herself ask you that why has this diagnosis been made, or if you tell her that you have a condition which is called ectopic pregnancy, and our consultant has gone through your reports and he has decided that going for a surgical removal of this pregnancy is the best treatment for you. And then she might ask you that how do you decide that that this is an ectopic pregnancy, and how did you reach to this conclusion? Okay, she might not and she may, but as you've already explained to her that based on the symptoms that you had and the ultrasound performed, it has been diagnosed, that it has been confirmed that you have a condition which is called ectopic pregnancy. Okay, and you do give a pause and you do ask her if she's okay, because she will be vulnerable. Okay, so you need to be compassionate, you need to be sympathetic. Now, just to keep in your mind, if you may have to give her information, or if she asks you how did you make this diagnosis at all, so you can give her some information like most women, they get physical symptoms in this condition in about 6th week of pregnancy, as she did as well, which is about 2 weeks after the missed period of the patient. And sometimes you may even not be aware that you're pregnant if your periods are irregular, or if you have been using a contraception and that failed. So each woman is basically affected differently by this condition, which is the ectopic pregnancy. Some women have no symptoms and some have a few symptoms, while others have severe symptoms, okay, severe pain, too much bleeding. And so symptoms vary, and it is not always quite straightforward to make this diagnosis of ectopic pregnancy. Okay, and if she does ask you about what happens in this condition, what goes wrong, that is the symptoms. If she asks, you don't need to give this additional information, but if she does ask you, you can just tell her that the symptoms may include abnormal bleeding, pain in the tummy, and these two features are actually present in the patient as well. Okay, and additional symptoms that you can give her, maybe pain in the shoulder tape, and sometimes patients have an upset tummy. For example, they may have diarrhea, or they may experience pain on opening their bowels. And in severe conditions, in severe conditions, they may have excruciating pain in their abdomen, and they may even collapse. So again, it depends on the question of the patient how much information you will be giving them. Sorry. So now you have disclosed to the patient that she has a condition which is called ectopic pregnancy, and the diagnosis has been made. Always, it is always important, whenever you are giving a new piece of information to the patient, you assess their knowledge first. So you can ask her questions like, do you have any idea about this condition, ectopic pregnancy? Or you may ask the question, have you ever heard of this term ectopic pregnancy before? Okay. What if the patient says, yes, I've heard about it? Do you still explain her in detail? Yes. So you appreciate that she knows, and you can still offer her. Okay, that you want me to to explain it to you in detail. Okay, and I will be talking about giving the information to the patient, or defining the ectopic pregnancy to the patient in detail in the next video. But for now, it's assessing the patient's knowledge is really important before giving them the information. Okay.